I think it is misguided to lump all breakthrough infections together because they're very different according to the groups that you think about. So group number one of so-called breakthrough infections are vaccinated people who, without any symptoms whatsoever, acquire infection and it's diagnosed as part of routine screening. These vaccines were not designed to prevent that infection. These vaccines were designed to prevent hospitalization, severe illness, and death. And they do that very, very well. In a recent study that Mayo was associated with, the amount of death in vaccinated people was 0. So it's very, very, very effective at that. The second kind of breakthrough infection is a vaccinated person getting symptomatic disease and having to be treated. For a vaccine that is 90% effective, which all of these approved vaccines are more or less, you expect to see symptomatic infections in 10% of cases. So the fact that we're seeing some of these vaccinated people get symptomatic disease is expected, and it's exactly how these vaccines should work. The third kind of breakthrough infection are the people we've talked about several times in this call, which are those people with impaired immune systems, and we don't expect those people to respond to the vaccine as well. In fact, that is why they were the first group recommended to have the third booster dose. In those patients, through no fault of their own, they cannot respond to the vaccine as well as your normal host, for lack of a better word. And those are some of the people we're seeing going into hospital now. So the efficacy remains very, very strong. These vaccines are behaving exactly as we expect them to.